Dear viewers, welcome to our channel. And today, we have a very, very special guest with us for the discussion. Just imagine a world where the medication, the allopathic medication, is replaced by, the sounds, vibrations, and there's a lot of innovation that's happening around the world. But one of the greatest things, innovations, which I have found, which is, the cause, mainly who is the inventor of a digital healing system through sound therapy, is Dr. Hukmani with us today. Welcome you, sir. Welcome you to the session.
Thank you.
And
Thank
I'm
you.
I'm Keshava Chandrasekhar. I've been an engineer and I've been studying astrology for last 30 years. And over the past few years, a doctor, an ophthalmologist has been working, as a eye surgeon who got interested and invented something very, very special. Today, I'm excited to introduce Dr. Hukmani and his journey through identifying a very innovative system in the area of medical science, which is a revolutionary system. And we are here to hear from Dr. Hukmani about what transformed into the medical practitioner, a innovator, and a person who developed a system which can heal people without medicines. I'm very, very excited today to introduce Dr. Hukamani. Sir, I'm really thrilled. I'm really excited today by what I have seen, what I have studied from you, and what I've gone through with you. It's a amazing thing which you have developed. So I want our listeners to hear from you everything that you went through. So, first of all, sir, I would like to ask you, how you started your journey into this area, which is, you know, planets, astrology, voice. So many things there. So, you were a doctor, you're a medical practitioner, and how you transformed and innovated this system. So, can you briefly explain, sir?
Thank you, Keshav, for getting me here over this podcast. For everyone, I'm really happy to be here. Good evening, everyone from India. And my name is Dr. Mahesh Hukmani. I was born and brought up in Jaipur, having my parents, both doctors, father being an eye surgeon in the Indian Army, and mother was a part of medical college teaching, always teaching students in anatomy. She retired as a professor in anatomy way back in 2006-7. My life as a normal child was like anybody else. There was a 9 to 5 routine which we actually saw in our house, and that 9 to 5 routine was the only blueprint which I could remember at that time, because I was also going to be a part of this 9 to 5 routine, which was definitely going to happen with an army officer who's so strict and wants to groom their children in a way that actually becomes, good for them in future. So after graduating, uh, my MS degree from SMS Hospital, Jaipur in 1999. I was a part of that system for another 10 years, 98 to almost 2008. I went abroad also. I was in Saudi Arabia to gain some more knowledge about how they treat and what is their system. Then came back, went into many many kinds of associations with many hospitals for operations, surgical performances, OPD alliances, and camp organizations, and it went on like a routine that which I mentioned, 9 to 5, till 2008. So that was the turning point in my life, which was never expected. It came very fast. So from 2008 onwards, my life actually started taking a U-turn. So this was the turning point.
Okay, sir, what exactly has happened? How you got interested in this area. So that is something, which is, fascinating. And I would like our, viewers to know more and more details about you, what you have invented. So we are making an attempt to give the maximum details so that, people get the benefit of the technology that you have developed.
Yeah, I'll tell you, I'll start with only one quote which says that nothing in this life is, easy. And at the same
Hmm.
time, when you look at the other part, most of the easiest things in the world are the most difficult ones. So in 2008, with a very disciplined life, a routine, you know, from 9 to 5, maybe 9 to 6. That was a normal routine until one day I heard that I was at that time, in Chandigarh. I had my own clinical practice, and we heard from one of our relatives, my father's younger brother, that your dad is not well, he's in the hospital, so you need to be here. So I stayed with him in a Jaipur hospital for 4 days. And the first day, when I went home to come back again so that I could also, freshen up myself, he was gone the very night. I could not just go and see him alive. He was gone. Now he was instrumental in getting me into ophthalmology, and there were many instances before that I had actually promised him that I would not like to go for this branch because I feel being caged. My passion or my life purpose is something different, which at that point of time even I did not know what was my life purpose. So I left my practice immediately after his death as a part of my promise to him, and went into a state of severe depression. Now, from January 2008 till June 2008, I was just trying to find out, solutions to how to get out of this. Following which, my mother, who also happened to be a doctor, she finally, you know, made me take antidepressants, sleeping pills. So my life became a zombie after that. I would take antidepressants in the morning, my mind would get so activated, and I had to take antidepressants or sleeping pills again in the night. So I was sleeping all the time. So this routine continued for about 3 months, and then I finally decided, to get back. Yes, the medication had done something good. I was feeling normal for the time being, and then those times I bowed before the bowed down before the universe to give me a solution, and it came on slowly and slowly. I started researching on various methods which were, meant unique to every individual, and there were only four options that I had. One is fingerprints. A lot of studies had been done on this. The other one was DNA analysis. A lot of studies had been done on this. The third one was iris patterns. A lot of studies had been done on this. The fourth one, which actually, intrigued me, was voice analysis, over which only the forensics had done something. Voice analysis during that time, way back in 2008, 2009, was only used by forensics to explore the possibility of a spoken lie in criminal investigation. So that way it started. I went through a lot of literature, and also at the same time I was praying to the universe to get me some knowledge, some downloads, which eventually started happening over a period of time. So by the end of 2013, I could, present to the world in the form of a press conference in Chandigarh in 2013, June 2013. And following the press conference, yes, there was a lot of media exposure and everything. But my aim was to, get rid of all those medications that I was on for the last 5.5 years. So I was the first guinea pig of this study and research. I took my own treatment system, which is nothing but voice analysis. When you record your voice, you get insights about your emotional level, your blood level, your body level. And looking up at my emotional level, since you are a student now, you will understand out of 36 frequencies, I had 18 frequencies missing at that time. And with the sound therapy initiated, went on for 6 months. Every 11th day, I would take a new sound therapy, record a new one, and based on the detection of the signals, I would take my therapy. On 24th of December 2013, I finally was able to kick off all the medications because the sound therapy, which were actually the supplements of the drugs I was taking in the form of sound frequencies, I was able to kick off uh, the medication, and much to my delight, that trend has continued from December 2013 till date. You can say 12 years now. I'm completely drugless. I don't fall sick because the energy which I have taken, it has taken me from minus to zero and then from zero to plus one, where uh, my personality changed completely from being an introvert to a highly extrovert, confident guy who can handle an audience of 2,500 people over a stage performance, stage speech. So this is how it has happened.
So it's amazing, sir, to listen to you and how difficult journey you had. And, and we say that, necessity is mother of all the inventions. So we have traditional astrology, which works on very historical data and most irrelevant data. And you have bridged the gap of either the physics, biology, and the meta science or the consciousness together through voice. And people say that the whole universe, the cosmic world, is created based on the sound, and sound and frequency is everywhere. Sir, can you talk about something related to voice analysis? What is voice analysis and how voice analysis can help, to the immune system or to find out the problems in a human being? And you mentioned that there is a, forensic system as well, which, you have studied. So if you can give me some brief introduction about the voice analysis system, it will help our users.
Even I started doing my research way back in 2008, I had very little knowledge about what voice analysis was. But over a time during my research, I found out that this was going to be the most interesting subject when it comes to pre-illness detection. Now, what is voice analysis? This is a very nice question because we are talking of the invention, which is voice analysis. When you record your voice, so because of the connections between the nerves, muscles, and the brain, you get a voice spectrum grid. When you record your voice, there's a software which shows you the distribution of um 36 frequencies aligned over the vocal cord. Okay. Now, these 36 frequencies are again divided into three. There is an emotional octave, there is an octave for physical diseases, and there is an octave for blood elements. So voice analysis is nothing but a holographic representation of your personality traits, disease indicators, vocal biomarkers, and there are many parameters that we use right now that include mental health mapping, coping up mechanism, root cause analysis, seven chakra analysis. So this is an integration of the traditional Indian Ayurveda with the modern science. Then we also talk of the five element analysis, the 12 meridian analysis, integration of traditional Chinese medicine. इसके अलावा when we talk of any disease, the diseases do not come inside the body just like that. They have to pass through six stages before they enter the body. So this is how the term or the theory of psychosomatic origin came up. Psycho means mind and soma is body. So every body
Okay.
is born in the mind, and it passes through blood in the fifth stage where the lab tests are either positive or negative, and the doctor would advise you to go for a lab test because there is no system with the traditional allopathic people who would actually go in for pre-illness detection and tell people what to do. And from the blood, it spills into the body, and we can predict organ risk prediction, whether any organ has been involved, whether the immunity of a person is low or high or weak at the time of voice recording. And we can also give the stage-wise progression of the disease, whether the disease is at the time of voice recording at stage 4, which is at the level of mind. There is no harm to the person. We would always ask them to come and record their voice for another 3 to 6 months, after another 3 to 6 months. If the disease is shown in the blood with certain deficiencies, this is where we are very, very sure that if these particular tests are done, there will be a sensitivity of 97%, as we have proven in a short-term study, which had only 110 patients way back in 2022. Now, if you see certain patterns in the level of the physical body, this is a time that your system is not going to work. So there's an integration of the entire community of medicine, traditional allopathic practitioners. So we would refer them there to get investigations done because we are seeing certain things happening in their body, which the normal traditional system is poised to miss every time. So voice analysis is a process of pre-illness detection by way of body frequency mapping. So I'll come to body frequency mapping. It's a very interesting term where the frequencies of all the emotions, the blood elements, and the body parts are mapped through voice analysis, and a subjective comprehensive analysis report is generated with positive points, different scores, and where the areas are weak, where and why we should be sending them to the lab or to the treating physician at that time. It's a warning system. I don't say that it's going to replace the traditional allopathic system, but it can be a complementary tool with traditional allopathic system where early diagnosis can be made so that all the people who actually want a good quality of life without spending more money in the hospitals, once they are diagnosed in stage 6, so they can actually use this system anytime.
Okay, so that's great to know. And doctor, you're really saying that the voice is beyond the microphone. So it can be used for various purposes, and it can be used to, identify the various, state of body organs, immune systems, and detect certain things early and do the preventive system, which you have developed. And it is amazing. So for the viewers, we need to understand that this innovation, which is beyond the microphone, which helps us to detect our own voice and identify, okay, what is coming up, what has gone wrong, and take corrective action without, or reducing allopathic system, reducing side effects. And doctor, you mentioned about the library, that is a vocal library that is developed, okay, for understanding and the mapping of the biological system. So can you talk a little bit about that?
Yeah, before coming to that, probably we have forgotten something, and I would like to come early with that particular aspect because that's the eureka moment which I felt, and really it bounced me up. up in the
Okay.
air.
Yeah.
During my research, I was thinking of pre-illness detection and everything. I was going through the WHO guidelines. I knew what was primary prevention. I knew what was secondary prevention. I also knew what was tertiary prevention. But suddenly, on one day, uh, suddenly it just stuck to me. Uh, as voice analysis as a pre-illness detection tool falls under the category of secondary disease prevention as approved by the guidelines of WHO. Now, till now, this has not happened. Either we have allopathic centers at the level of primary healthcare, where the doctors would advise certain lifestyle changes, exercise kar lo, acha kha lo, gym chale jao, meditation kar lo. So this is primary prevention, and tertiary prevention is where you get admitted for cure either by means of medicine or surgery. So where does secondary disease prevention using voice analysis fall? The WHO says you must have a system that can detect a disease in its asymptomatic or latent stage where there are no symptoms. And this is what happens, There are no symptoms of disease, but definitely there are symptoms of emotional unrest. So this is how
Yes.
we do not compare ourselves to the traditional, but I think we are far advanced because we are doing mental health diagnosis also. So there's another niche that we'll be talking in our upcoming podcast, mental health. How does JV scan voice analysis help in mental health diagnosis?
Okay.
Now, you had a query, like please come again because I just forgot the query that
So
you.
my query was, you mentioned that you have developed a library which is mapping frequencies
Yeah.
and the biological imbalances.
Yeah, so these libraries are nothing but frequency associations. See, there are 36 frequencies, and there were 12 frequencies which give you associations only about your emotions. So each frequency has say about 15 to 20 emotions, linked to it. And every emotion, when I speak of psychosomatic origin of a disease, passes through different stages. If I talk of insecurity, if a person has insecurity, it will tell you the root cause analysis. Probably some kind of surgery in the childhood, neglected childhood, malnutrition, if they were feeding difficulties when the child was born. Like these are the reasons why insecurity would come in. Now, how it is going to progress further till it gets into your blood. So these are the associations which we have defined, and these are called frequency associations.
And Doctor, what is the relation between the frequency and the DNA structure, and how it is there interlinked?
See, every frequency is linked to DNA because where are the frequencies working? The frequencies are working at the quantum level, right? The frequencies are working at the level of mind. The frequencies are working at the level of each cell, right? And
Yes.
science says it is the energy of the interior internal structures created by mitochondria, which creates ATP, and this is how the correlation between the frequencies is there. Second theory is that at the most tiniest part of the atomic level, we have neutrons we have a cell in which there is a neutron atom has a neutron, and electrons are rotating. So these are responsible for frequencies. So both ways it is correct. Now frequencies will be affected. So when the frequencies are affected, DNA is also affected because every cell has a nucleus in which trillions of DNA molecules are. So this is going to be in a very deeper section. Superficially, I can say yes, if your frequencies are imbalanced, you need to correct them as early as possible before they go into the DNA. And if the DNA divides, these abnormal DNA cells, they create um, a very deep impact on the cellular structure at the quantum level. Bad memories are formed in the cells, which are nothing but a part of, disease process, just trying to put its foothold at the level of quantum.
Yeah. So it's very important when you detect any imbalance and understand the root cause of the imbalance and treat it with the proper frequency, you know, anything in the sense that any kind of disease or organ damages can be prevented, can be stopped. Because today, people are very skeptical about a lot of things. They people either don't believe such things, or people doubt a lot of things. So what do you have to say about those for those people who are skeptical?
He, you cannot stop people from being skeptical. The only thing that you can do is generate and create more awareness.
Yes.
Get to them, uh, tell them exactly what it is, and ask them to use the system once, because we always give first reporting. Anybody who comes to me, I'll always give them a reporting free of cost so that they can understand the system. Now, still many people don't understand what exactly the reporting is. And so you have to explain to them what exactly is happening inside your body. So
Yes.
out of about 7,000 people that I've scanned for the last so many years, 12, 15 years, I've seen many people, agree. There were few people, very high level individuals who would always get into a state of denial if there was something wrong. But then they accepted this fact when I told them there is a problem with your gallbladder. And one of them immediately snapped back, "How do you know?" I said, "Your voice is telling this." And he said, "Yes, I don't have a gallbladder."
Yeah.
And there were many instances in Delhi. I was a long time back, and some reference came through a friend of mine, and he was in trouble. And after his scan, I told him, it looks like you should visit a nephrologist because your kidneys look, you know, problematic. There is an issue." He said, "I'm on dialysis. I have only one kidney." So these are the instances which have actually motivated me, to go further ahead and, get to more people. Uh, I iterate the system so that there are more new things coming, iterating the technology, adding more things. This is an ongoing process, and it's going to happen till I am there.
Yeah, it's very interesting topic, doctor. And how do you relate this? The origin of psychosomatic or mind-related problems which cause the organ damages or the disease in
Hmm.
early stages. How do you really identify these things? Can you give some ideas about it?
Yeah, as I said, things that look difficult are the most easiest one to understand. So for common people, it must be uh, a thought or a perception that this is something very difficult. How do you read a CT scan? How do you read a voice analysis scan grid? But I can tell you very clearly, when you record a voice, there are patterns, and then there are empty boxes on a particular octave. There are weak frequencies on a particular octave, and the frequency association cards are there with the practitioner. If I talk of D major, if D major is missing, that means the person is definitely going through a period of loss of self-esteem with no confidence. Okay, morally on a lower scale, passion gone, right? And then he goes into different projections, where if he's unable to handle himself, there are many other things which happen. Eventually, in the blood, there are changes, and then in the body, kidney, uh, your reproductive organs, D major especially, blood elements, they all go, intestines, they all start showing. And this process is not so fast. So if you take care of the missing frequencies at the level of mind, you can stop or reverse the progression of that emotion into the blood. That means you have achieved disease prevention already.
Yes. Yeah, I think that's really interesting because coming back to the point of astrology, Like in the traditional astrology, people look at the chart, recommend various remedies and things like that. But most of the times these astrology remedies fail because they fail to address the root cause. And the reason I'm pointing out this at this point of time, for people to relate the topic that you're really talking about can be used as an alternative to astrology as well and get quite effective benefits. And people have seen tremendous results because I myself have seen the results. Okay, I have been your student. I've taken your recommendations. I've implemented it, and it has given amazing results. So at this point of time, okay, the reason I'm asking this question is that people can relate, okay, where we are coming from and what it is relating to, how it is relating to astrology. And from the astrological point of view, people think, okay, birth chart is everything. And people don't consider what has happened throughout their life and how it is going to impact, okay, the body, the energy levels, and the results that is giving impacting in the area of relationship, health, money, career, etc. So can
Yeah.
you give some light on that, sir?
Yeah, a good question. As you know that voice analysis has three verticals. I have not yet told you about the third one.
Yes,
First is voice analysis for pre-illness detection for health. Then voice analysis for uh, coming up with the deficiencies of your 27 nakshatras and nine planets. So this is under a new name called voiceology, and in Hindi we call it Swar Nakshatra Vigyan. Swar is the sound, Nakshatra is the lunar mansion, the lunar modes, and Vigyan is the sign. This is the science of the sounds and frequencies of the planets and nakshatra. So why do we actually have to do it? Because of the concept which says, as above, so within. There is a
yes, yes,
broader,
Brahmandi,
yeah,
Pindandi. So
yatha,
there is a sense,
yatha
yeah,
pinde tatha brahmande,
Brahmandi.
right? As above, so within. So the macro universe, which is so vast, with so many galaxies, Milky Ways,
Yes,
stars, planets, nakshatras,
yeah,
they
yeah,
all have five elements,
yes,
right? Earth element is there. We have the water element, we have the fire element, we have the air element, and the space element. These five elements,
yes,
represented by the 27 nakshatras and nine planets, they also have
yes,
frequencies. They are also within us. They govern certain emotions. They are located over the central axis of the human spine, right? And they
yes,
also affect organs and blood elements. But again, it is the same psychosomatic. Here also there is a psychosomatic aspect. What
yes.
people
I
in
think
what
I
people
think clinically also it is proven,
it
right?
is proven.
80% of the diseases originate from mind.
Yeah. So what people do in astrology, they would if somebody has a Ketu dosh, if Ketu is in eighth house, and supposing Mangal is also in the eighth house of the same person, Lal Kitab remedies are the most famous ones, most trending, that they will say, okay, चितकबरा कुत्ते को रोटी खिलाओ, या काले कुत्ते को रोटी खिलाओ, या हनुमान जी फॉर मंगल, मंदिर जाओ, मंत्र पढ़ो. But then they're falling short of something, okay, or they will give a particular mantra for Ketu. Now,
Yes,
now this every planet is not just governed by its own frequency; it is governed by three more nakshatras. So if you fail to
yes,
understand the value of the frequencies of these nakshatras one by one, supposing Ketu is okay, in spite of its position in the eighth house, केतु ठीक है, बट उसके जो तीन नक्षत्र हैं, उन तीन नक्षत्रों की फ्रीक्वेंसी मिला के द
yes.
वाइब्रेशनल स्कोर ऑफ दिस लेस देन 30%. What will
Mhm.
that mantra? So if we just talk about one planet, And do not think of the three nakshatras that it has. It is like three streams of water coming into a reservoir to fill it completely. The reservoir here is nothing but the planet. The three streams
Yeah.
of water are three nakshatras. So by just giving the remedy for Ketu, this will not work because the Ketu may be okay, but the three nakshatras belonging to Ketu are probably having less frequency. They're not vibrating to their optimal. And every nakshatra has an impact, not only just our lifestyle, our emotions, our body, and our personalities, including the blood.
Yeah. So that is why it is called energy triangle, isn't
Yes,
it?
see. And then, so when we say nakshatra, that means the power, the energy, and the frequencies of the nakshatra over octave 4 will represent when these the energy process or the disease process will spill into the body where the disease marking agents, I would say, are nine planets, not nakshatras. Nakshatras work on the emotional level. So once this happens, because it takes a longer time for the emotion to, create a state where, it becomes a behavioral pattern and then spills into the blood, and from blood it comes into the body. Ketu, if I'm talking of Ketu, it will give diseases pertaining to the root value that it has, and the nakshatras will give you the emotions. I'll show you.
Okay.
Here you can see
Yeah.
the human spine. I can,
Yes.
all right. So this is cervical
Yes.
region, C1
Yes.
to C7, C8. Then it is thoracic up to
Hmm.
T12, lumbar
Yeah.
L5, sacral S4, and S5 coccygeal 1 or 2. So
Okay.
how are we placed here? The nakshatras.
Hmm.
Ketu C2, all right. And
Yeah.
it has got, we are talking of Ketu axis. Ashwini represents C2. So if you look at the associations of C2, especially if you look at C sharp, a lot of
Hmm.
regrets, a lot of severe pain,
Yeah.
regrets, and many things are
Resentment.
associated with. The other one is T4. So
Hmm.
when Ketu is affected by C2 and C2 emotional quotient, starts growing and growing and growing, that means C2 will give you diseases in this region, cervical. You may have cervical pain. You may have scapular region pain, which is cervical को ही कहते हैं, shoulder blade pain, arms का pain. Then when it
Hmm.
comes to Magha is T4. T4 is T4 T5 is very very close to the heart, lungs.
Okay.
So this will give you this. Then Mula Nakshatra.
Hmm.
L1.
Yes.
That means Mula Nakshatra, if you look at it, it's either C major or C sharp, I don't remember. But Mula Nakshatra
Hmm.
will give you any diseases below the waist, all joints, skin problems,
Okay.
okay,
Hmm.
constipation, prostate, hip joint pain, knee joint pain, ankle joint
Hmm.
pain, all kinds of pains, skin allergies, and everything. So this is how I wanted to explain you why we would not just the traditional astrology, वो हमेशा एक ग्रह को पकड़ के उसका इलाज करने की कोशिश करते हैं, बट हम लोग थोड़ा सा और डीप जाते हैं और इन तीनों
Hmm.
नक्षत्रों को भी समझ के इनकी भी डेफिशिएंसीज को करके एंड देन वी डू अ वॉइस एनालिसिस.
Yes.
Okay, and once
Yeah.
we find out over the fourth octave that these are missing,
Yeah.
we will create a report. Now we have a
Hmm.
report which is astroplanet frequency report analysis, which will give you
Correct.
the direction of all the navgraha. We also have a
Yes.
27 nakshatra frequency analysis report in which
Yes.
all the 27 nakshatras spanned over the fourth octave, their vibrational scores, their total score, vibrational score, and there are recommendations. Now,
Correct.
the treatment part, which you must be knowing and observing even now, is
Hmm.
five-layered treatment. For
Yes.
astro planets, we have the astroplanet sound frequencies. We also are going to include some mantras for them. But
Correct.
at this time, we have only astroplanet sound frequencies. For
Yes.
nakshatras, we have five layered. We have
Yes.
the nakshatra sound frequencies. Okay,
Yes.
as we do for astroplanet and as we do for JV scan. You know,
Yes.
that protocol we have to follow every 15 days or maybe 11 days. Then we have
Yeah.
nakshatra bij mantra. For every
Yeah.
nakshatra, there is a bij mantra that we create and give it to the client to listen to, because Beej mantra is something which is going to create some connection with the nakshatra lord, which also we have nakshatra deity mantra. We also have nakshatra
Yes.
name
Yes.
mantra.
Yeah.
So we have for nakshatra remedies, we have nakshatra beej mantra, nakshatra devata mantra, nakshatra name mantra. Then we have uh, this combination of science and spirituality.
Yes.
The root value of a particular nakshatra, if it is E major, as in Hasta nakshatra,
Mm.
we will record that over the fourth octave, and we'll use all the ragas, all the instruments which the Hasta nakshatra is fond of, and give it to
Yeah.
the client to listen to. And which is the fifth one, the sound frequencies they
Sound
come. So, right?
frequencies. Yeah.
So
The musical notes.
notes and
Yeah.
sound frequencies. So five layered. So why would people not get well, with this? I've seen myself, I've seen you, because anything I start, I will experiment this first on myself and then give it to others.
Yes. Sir, I really, correlate what, Vedic rishis and munis have developed. Like, they told that Deho Devalaya Prokto Jivo Deva Sadashiva. Means the body is a of primary importance, and it is like a temple.
Absolutely.
And then another shloka says Chandrama Manaso Jata, which means that, you know, my moon is responsible for the mind.
Yes.
And now here, okay, from whatever you have told, what I can correlate is the, the planets or your kundali, okay, is the energy that you had when you're born. But over a period of time, it gets changes, or it changes because of the food you eat, because of the people you come connection with, because of the environment you live. So various factors influence,
Yeah.
and the current state of you is quite different.
Yeah.
And your kundali cannot exactly explain, okay, what is happening inside you. Only your body can tell you.
Yeah. That is true.
And yeah, so and there are different energies that you can tune, and you can, increase your frequencies and vibrate at a higher frequency
Yeah.
and get the, things sorted. I mean, the same like astrology remedies, but more accurate and better remedies you can get from here,
Yeah.
understanding yourself
That is
better.
because astrology is based on the date and place and time of birth of an individual at the time of birth. So I'm 56 now, and I have completely understood this concept that those frequencies don't affect me anymore, because I have done a lot of puja part sadhana. I do a lot of karma. All right, there are many practices which will dissolve those no negative influences of these. So how can you, although people do, yes, I'm not going to challenge anyone here. With a disclaimer, I would always say, how can you rely on your static data that was 30 years back or 40 years back and not think of a real-time data which is inside your body and waiting to be detected through voice analysis, the frequencies. Oh, why is anybody at
Yes.
workplace feeling pressure? Why is anybody, I talk of single mother, who's working, has those particular issues which others don't have? Why does a
Yes.
businessman, have to be more disciplined in their approach, right? Why? Why do they have work anxiety? Why is their work home imbalance? It is
Yes.
because of the emotions. Now we further
Emotions.
go down. what is responsible for these emotions. If your nakshatras are strong and balanced, these outer influences are not going to influence you. You have
Yes.
to, yeah, your inner universe is, if it's so balanced and strong, nobody can actually manipulate you to get you into a state of stress, anxiety, depression related to external environments. It could be your office, it could be your house, maybe you have relationship issues. It could be your relationship with money, but probably you're not able to do this. You've tried everything. Now there's one person I was just preparing a report of, and I was really surprised to see all 8 money nakshatras in his chart were weak or almost missing. And
Yes.
this guy has struggled. Pushya, Dhanishta, these two I remember, all Shravana, all were not there. If there is no spark in that particular
Yes.
nakshatra, which is responsible for a particular event or department, what will you do? Nothing. All you have to do is listen
Yes.
to those sound frequencies. We have protocols made wherein sound frequencies will go on for three months, but at the same time you will also supplement them with the nakshatra bij mantra, name mantra, note
Yes.
music, right? So this is how
Yeah. So really, those bija mantras are designed, you know, to vibrate in certain frequency, and that when it is chanted in a certain tune and certain raga,
yeah,
that makes it really, really powerful, isn't
yeah,
it, Doctor?
yes,
So
yes.
that's what
So the best part
Yeah.
of these raga frequencies is like supposing I'm doing Rohini nakshatra. Right. So the raga for that nakshatra is completely different from what I do for Uttara Bhadrapada. And now
Correct.
the instruments that I use for Uttara Bhadrapada nakshatra are entirely different from those that we use in Rohini nakshatra. Because
Correct. Yeah.
Uttara Bhadrapada uh, may be having different instruments to the liking. Now suppose I like overdrive and you only like sitar. Oh, what will I do with something which is given to you presented in the form of overdrive?
Yes.
So it has to be in that
Yeah.
very essence of the deity,
Yeah.
the likings and the dislikings of the deity. If you are trying to
Yes.
please your deity to raise the vibrations, you have to give them what you want, what they want.
Yes. Yes.
Then only
So
the system
when
becomes.
Yeah, when you talk about deity or when how it impacts on the system, it works at the level of subconscious mind as well as the cell level,
No,
isn't it? The
no, no,
cell.
no, 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 no. So it's a entirely different thing. We have to
Okay.
understand. We have to understand what is soul consciousness.
Okay.
Okay, soul consciousness
So can you?
is.
Yeah.
So we'll do it in some other time because very detailed. I'll
Sure.
I'll be very brief
Yeah.
here. It is the soul which is the life within us, the prana, the she. So
Yes.
the soul also has a consciousness, and you
Mm-hmm.
will be surprised that your soul energy has never been contacted by you through commands. It is waiting
Mm-hmm.
for you to
Okay.
give the soul certain commands, because soul will do everything for you if you command. Okay,
Mm-hmm.
for that there is a system we
Yes.
have. We also have a system to activate that
Okay.
soul consciousness. And
Okay.
if you start your practice of this mantra therapy
Mm-hmm.
with a prayer to the soul energy that I am giving you these mantras, this music, raga, these instruments, do the best to me based on what is deficient in my body.
Mm-hmm. Okay.
Just one prompt before you start.
Yes.
No need to, uh, if you want to do, yes, especially Uttara Bhadra Nakshatra, Ahirbund is the Lord. You can also think of him, pray, and then also pray. to the soul energy to accept what is being delivered for the best results.
Okay.
So why it will happen? Because it is science based, yes. Secondly,
Mhm.
the soul energy will have better connections with your nakshatra lord than you.
Yeah.
So it is acting as
So
a
when you say,
medium. It is acting as a medium between your Lord Nakshatra and your body cells to do the
yeah.
rest.
So when you say a soul nakshatra,
Hmm.
it really means that your birth nakshatra, isn't it?
No, I'm just talking about the soul energy, which is the life driving
Yes.
force. That is it.
Yeah, that's your birth nakshatra, isn't it?
No, 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 no.
Or is
But
it
Nakshatra, it is the Atma. I'm not talking of
Atma?
Nakshatra. I'm talking of Atma, soul.
Okay.
Yeah.
Okay.
So soul
Hmm.
communication is another very interesting topic that we will definitely
Okay.
look into.
Yes, we will definitely do some other time. Yeah. So, okay, Doctor, thank you so much for being with me today and throwing a lot of knowledge, light on different topics. And I think our viewers will be really, really, be take advantage of all these systems and, try to understand more and more about these topics. And we will cover a lot of other things in the coming podcast.
Yeah,
Thank
yeah.
you so much.
For the message, I'd like to convey a message to the viewers that this podcast series is the first, and there are going to be multiples in hundreds, and we are going to try
Yes.
and cover the most interesting topics, bring to you something really innovative and something very different. But the main idea and the vision mission eh, while starting this podcast series is to heal. As a doctor, I've done
And
this. As a doctor, I've done this. As an entrepreneur, I've also done this with voice analysis. Now, I'm coming to you as a doctor, entrepreneur, and again innovator with voice analysis and astrology. And it's my promise that what we deliver to you will definitely help you in your life path, in dissolving your life blockages. And we wish you all the best. And stay tuned. We are coming up with a more interesting topic each day. Thank you so much for being with us. Thank you, Keshav.
thank you, sir. That reminds me, a sentence from Bhagavad Gita. Krishna told about the Jnana Yoga and Vijnana Yoga. Means, you have to develop a knowledge about yourself, and that becomes a science if you apply your knowledge. So when you understand blindly certain things, it is not a science. So we are really, what with your attempt to innovate things and give this idea how the body is related to the cosmic energy, this science of vibrations, frequencies are really amazing. And, I could relate a lot of things. So thank you, doctor. Thank you again so much. And we'll get connected in next podcast. And, I'm sure that our users, our viewers will get a lot of benefit from this podcast series.
Thank you so
Thank you
much,
so much.
everyone.
Good night.
Before we leave, thank you. Jai Hind, Jai Bharat.
Thank you, sir. Thank you so much.